Good afternoon, everyone. Welcome to the latest installment of the Renton Learning Network. All right, we are going to go ahead and get started. We've got a great program here this afternoon for you. I know school is out, but we are still working away here and excited to kind of wrap up this school year, 23-24, and talk a little bit about the accomplishments of Renton School District and their community partners, and then talk about the plan for in preparation for next year. And we'd love to get your feedback on some of the proposed plan. This work we know we can't do alone, so it really takes all of us sort of working together. So any feedback you have during today's session, feel free to come off mute, raise your hand, ask questions, or drop a message in the chat. Erica will be there taking your questions and making sure we get those answered. So a little bit about the agenda today. So we'll kick the meeting off with Vicki Blakeney, who I think you all know pretty well, the Director of Student Services at Renton School District. She'll be giving us a reminder of our North Star. I think we have some new faces here today, but just laying out sort of where we're headed, and some of the history of the development of this work and our progress to date. Then Vicki's going to hand it over to Davina, who's a mental health facilitator at Renton School District, who's going to talk specifically about the accomplishments over the last year. And then we'll have Davina from the school district, Mary Jane Van Cleve, who will be joining us from the city, talk about plans for next year. And then Celia is going to give us a little bit of a teaser into some of the software, the Hub software that we've been developing and planning to launch here in the 2024-25 school year. And then we'll open up for questions and answers in the back part of the session, but anything that comes up during the session, feel free to jump in. Quick reminder, closed captions are available if you just click the CC button. If you have any trouble, feel free to drop a note in the chat and we'll troubleshoot that for you. We'll be muting folks for the majority of the meeting, but you can come off mute. Just raise your hand and we'll make that happen. All right, I'm going to stop talking and kick it over to Vicki.
Great, thank you, and thanks everyone for being here, and for those who are watching us on recording, I appreciate it. I just wanted to go backwards to go forwards, basically. So I wanted to remind us all of how this work began, where we're going with this work, what our vision is, and hopefully you'll see that our vision is co-developed with you all as part of this Renton Learning Network and some of these meetings we've had in the past. So our idea in the beginning was that we wanted to make sure that every student had access to all the services that they need in order to succeed in school. So that in order for them to come, show up, engaged, and ready to learn, they had the mental health that they needed, the foods that they needed, the activities and access that they needed. And we wanted to make sure that it was equitable, because there's a challenge that comes when maybe these services are provided based on who knows which community partners to bring in, or who has a relationship with which mental health provider, that sort of thing. So we decided that the way to do this was to work with our communities and build out this bigger vision. So as you can see on this slide, we have this incredibly exciting vision of how schools and the city governments and everybody else can work together to co-develop our student and family-centered services, so that our students show up at our doors ready to learn, engage, and leave our buildings successful and happy and functioning. And we want our schools to be the best schools possible. So that's our vision here. I'll show you what I mean by going backwards to go forward. So as you know, in society, schools have been facing growing student mental health crises, and we've had answers to that as much as we can here in the Renton community and the Renton School District for a long time. So we've had community partnerships with a lot of you and a lot of the other agencies that you'll see, et cetera, here. However, we were always able to use those community partnerships to at least attempt to meet the needs of the students in a pretty effective way. And then, as we all know, something happened, right? And COVID shut down schools, and they remained shut, and we had to move everything to remote learning. That, along with other factors in society and a lot of other things that were happening, when schools reopened to the, the kind of more traditional schools, we were no longer able to meet everybody's needs. Our schools became overwhelmed. Davina began a project that you might remember or have participated in, where she started looking at what services were available at every school. We did this sort of a mapping project to see what students were getting, what services, what partnerships existed at each school, what counselors knew, what social emotional learning programmings were happening, all of these things. We attempted to map out the services that we had to see what we could do. And what we discovered was that we needed to find a way to fill in our gaps, to connect more closely with our community, to get all of us working together to be a part of the answer. Because for no fault of anybody's, our wait lists were huge and our services were not available because there were too many needs and we were overwhelming them. So thankfully, this kind of mapping project had already begun, and our ability to take that and kind of move forward into the next step. We were introduced to the right people at the right time and began doing what I believe to be the right work. And so we're about to show you what that right work is going to look like. So this kind of challenge became a catalyst for something more, even bigger than I could have dreamed of it looking like. And I hope you're getting excited about what's possible as well. What this turned into was what we are now referring to as the Student Health Hub. So in the Student Health Hub, we spent the last 5 years, like I mentioned, sort of gathering together the right partners, trying to figure out what it meant, mucking around in our curriculum map, talking to and doing some assessments with our student body, with our staff, etc. And in the end, we decided that the best approach maybe to start this sort of no wrong door student self-health hub that our partners here at Health Commons are going to show you in a little bit. So what we ended up coming up with was a way to put everybody into sort of a front door approach where they can easily access their services and the supports that they need through this hub process. You'll see some of the power of joining this group that has this expertise in technology and bringing together different sectors and what's possible as a result of this. So the good news is that I'm not in charge of inventing this. Davina's not inventing us. All of us working together are going to create this, and we're following a model that you can also look at, the community care hub model that came from the Camden Coalition, and that will give you an idea of where we're hoping to go with this. I just am very excited about sort of this next iteration, what's happening next. So I just don't want you to not see yourself in this project because so many of you had a part in it in the first place. So many of you were part of these earlier conversations, helping us to dream up what's possible. And then, for example, Dr. Berkowitz started introducing us to some people around the community. And then Davina began meeting with many of you to start MOUs. And then we realized that the MOU process might not be as strong. So we started looking at a new process. And all of these things came from just talking to all of you. And then meeting with Health Commons and leaning into their experience and their expertise has just been invaluable. My goal with this slide is really to show you that what we're attempting to do is build a system of support for our students, and that this particular piece, this hub, the Student Support Services menu, all of those things, those are not in isolation. That as a district, we are building a menu of supports for students, and that there have been, as a result of the increase in mental health issues, et cetera, and also a concurrent increase in the supports that have come with trying to help all of our students. So we have worked with a lot of new partners, a lot of people who are saying we want to be a part of the solution here, and we just want to thank them for that and let you all know that we're building a tiered system of support for our students. So before students even access this hub that we're talking about, we have universal supports for students. So we're teaching mental wellness, we're teaching social emotional learning to our students. We are working with our partners from the Providence Rave Sounders group to build out play spaces for students. We are working with King County to do universal screening for students. We're working with Work to Be Well to do mental health wellness clubs for students. We have school social emotional learning facilitators hired directly in the student support department. So there's a lot going on to support all of our students in this, and there's been a lovely, and I just think something they can be really proud of, an emphasis on this in the Renton School District. And that's given to all students. We also believe that in many instances, schools can be the solution, right? So they can provide some targeted supports as well. So we have peer support groups, we have suicide prevention groups, wellness small groups. Our counselors from our schools are involved in providing groups and supports for our students that indicate that they need a little bit more help than sort of that universal all students. And I feel like our schools are well equipped to provide that support. It's this last group, this tiered individual supports of the higher need students that need individual type work that maybe we can't do on our own. Where we're saying, let's pull in and ask the community to be a part of that solution for us. Because, for example, our school counselor, let's use them as an example, they have 250 to 300 or more students on their caseload. And so they're not trained to be mental health providers, they're trained to be school counselors. So we need to tap into our community partners and our other resources to help us to get to that North Star where all kids are able to come to school ready to learn with all of their needs met. So if you have any questions about the other work and how this is being a part of a bigger process, please let me know as we go on. And go ahead, Davina.
Hi, everyone. It is a privilege and honor to be able to share with you in the next slide the accomplishments that we've achieved this past school year. And it's so exciting because this is just going to show you that it really does take a village to meet the needs of our kids, right? And so we're serving the same students and families. So to be able to do this work together has been truly amazing. That's an understatement, if anything. But wanted to go over some of the accomplishments we've had this past school year. And some of you may have heard, we have been partnering with the Sounders FC and Ray Foundation as well as Providence to really destigmatize mental health and then also promote mental health and wellness and looking at physical and mental health and wellness. And so really looking at the whole child and how we're supporting our students in their own well-being. And so this past school year, we launched in 4 schools, and those 4 schools are Nelson, Dimmitt Middle Schools. And then we launched in Tally High School as well as Lindbergh High School. And so we have been really fortunate to be able to work with them in really trying to destigmatize mental health, really looking at mental wellness curriculum and how we're intentionally getting student voice in what curriculum is being shared, as well as developing a couple mental health clubs within their schools. In addition to that partnership, we also have access to Hazel Health, which is teletherapy services. And so the nice thing with this is that we have been able to provide mental health services for all of our students, pre-K through 12. And through that, 594 students were referred for services. And then out of that, 331 were actually served, and a total of 1,962 visits were completed because of that. And so really the partnership with Hazel Health is to help us as a community in addressing the mental health crisis, look at how do we build capacity of our local providers and support each other in doing this work. Because it's not easy, we all know that. And also, as providers, you have your own requirements that you have to meet. And so And so really working together to try and problem solve, okay, how do we best meet the needs of our students and families has been really fortunate to be able to work together to do this and be able to ensure that our students have the access. Because the other thing that we implemented for the past couple of years and have continued to expand is SB SBIRT, and that stands for School-Based Screening, Brief Intervention, and Referral to Treatment, or referral to supports. And so really this is a universal mental health screener that we've been implementing for our 7th graders at Dimmitt Middle School. For the first time, we screened the entire 7th grade level, and we expanded that with 2 pilots classroom screenings at Nelson Middle School. Through the SBIRT work and through the Health Hub, we've been able to onboard 9 community providers. We were able to screen 224 students, and with that partnership that we have with Health Commons as well as the community providers, with this, we were able to match 22 students. And these students are students that are Medicaid eligible. And so granted, our students who have private insurance, of course, we were very fortunate to be able to refer to Hazel Health. So it's kind of one of those things where there's no closed door. We had access, and that is one of the things when we wanted to implement SBIRT, we wanted to be able to ensure that we could provide the supports, or we had access to those supports to reach out to for our kids to be able to address what their needs are. In the matching, one of the things that has been really amazing. As you all know, it has been really hard for our kids sometimes when they're being referred to services to get a therapist. And so one of the things that we saw with this hub is that the turnaround time of matching from when the referral was made to a community provider was an average of 8.15 days. And so what you'll see, the link was provided in the report, in the chat. The link that was provided is for our quarterly 1 report. And so that was the first quarter that we implemented this. And so the information that you're receiving through our presentation today is the most recent. This is from the rest of the school year until June. And so, we've been very fortunate to be able to implement these things, and it's all been successful, and there's more, right? There's more work that we need to do. And we're learning things as we go. And so one of the things that we're really hoping to do this school year is through the Providence Sounders Ray Foundation partnership, we are going to be expanding to 2 additional schools. And so those schools will be Hazen High School as well as Renton High School. And the nice thing with that too is, of course, at Renton High School, we have our partnership with Health Point. So really trying to figure out how do we help each other in getting access. How do we integrate the work that we're doing, because we're all trying to promote the same work, and so how do we do that intentionally is really important to the partnerships that we have. The other thing that we're also looking at doing is expanding. With Hazel Health, we're going to continue to offer those services to our students, all students. The thing that we're really wanting to work towards is how do we also integrate Hazel Health with our hub services. So one of the things with Hazel Health is that Hazel Health, you have so many sessions, and if kids are needing ongoing sessions, we have to refer them to outside providers or local providers, whether that is a private insurance provider or a local community health provider. And so really trying to look at how do we help each other when we're trying to make these referrals, because either way, there are students, and we want to ensure that there's closed loop communication and coordination when it comes to their services and needs. And then for SBIRT, this is really exciting. We are going to be launching a new hub software for the referral to treatment piece. And this is specifically for our behavioral health providers. And so I'm really excited that we have Celia here today to be able to show you and demo for you what that looks like. So I'm going to go ahead and pass that on to her.
Yes, thank you, Davina. And hi, everyone. I'm Celia McTeague at Health Commons Project. So great to see everyone here. I know some of you, but I'm excited to get to know the other ones that I don't. Thank you, Davina, for the introduction. As Davina was saying, she kind of introduced SB Expert and the work that RSD has been doing around that. SB Expert, for some background, has been developed and implemented in 14 school districts in King County, including RSD. And again, for that background, what it really stands for is screening, brief intervention, and referral to treatment. Although we do kind of like to say referral to supports or services. And these are kind of the three main components of the program. So RSD through screening, students basically take an interactive, 15 to 20 minute questionnaire called Check Yourself that provides instant, basically personalized feedback about health behaviors and helps determine whether students need additional supports. If students need additional supports, RSD has been doing brief interventions based on the results of the questionnaire. And this just involves school staff, counselors, district staff connecting with students one-on-one who requested support or who were identified as needing additional support to figure out what was going on with the student, really learning more about what their needs are. The school would, of course, fill those needs, but if it was hard to do within the school, as Davina was talking about, they would be referred to supports or services, often through the hub, which I'll get into. And what the hub is basically a HIPAA and FERPA online application that collects student consent, submits student referrals, and matches them to services in the community and tracks their progress. So it's really helping to uplift and improve care coordination between schools and community organizations and providers. So really for the last 2 years, Health Commons has been working with Renton School District and community behavioral health providers to co-design and implement the hub to really support this referral to treatment or referral to supports or services part of the SBIRT process. So we were able to launch in December 2023. So it's been about 6 months that the hub has been operating, and it really simplifies care coordination, as I said. And it's been able to give a level of metrics and oversight and visibility that had previously been lacking. So I definitely suggest you all look at the Q1 report, our Q2 report, which will cover April through June. In addition, will be released in July. So we'll definitely send that out to all of our stakeholders, including you, so you can see kind of the year as a whole through the hub. And as Davina was mentioning, we have a hub application that we have been putting in a lot of work to, not just Health Commons, but Renton School District, school counselors, our behavioral health organizations. They've really given us feedback over the past 6 months of the hub and really have allowed us to iterate it for next school year. So very excited to kind of demo the hub for you today. I'm going to work with my colleague Erica on the call to demo some of the processes. Awesome. Well, everyone, welcome to the new improved hub dashboard. We're very, very excited about this dashboard and the work that's gone into it. This is an example of a dashboard for Sound Health, as you can see, and it really provides a quick snapshot and history of all of the referrals sent to Sound in this case. But the dashboard would be the same across all providers, but of course individual to each provider. So here you're really able to get a quick look at all of the referrals, including the submission date, who is being referred, who they were referred by, who the counselor was. You're also able to see the district and the school that the student came from. You'll also notice, which we think is a huge improvement, is a status, which is basically giving you a quick look at where the referral is, basically in the pipeline. And we've really done a lot of work here to make this as simplistic and easy to use for provider partners. To see the details of a student, you just can click on a student and go into the referral record, and it supplies additional information about the student and the referral. So let me click on Teresa. Here is the record view for a student. This is giving you additional information as to Teresa and Teresa's needs. You can see a student's summary. You can see the reasons for referral up here. You can see who the primary contact is. It's really giving you, again, additional information that is quite critical to a student. But this is not all of the information. So we do have a button down here where you can see all of the referral information. This is everything that was submitted from a school counselor or school staff member about Teresa. Oh, I have to move. My Zoom is in the way. There we go. So very excited to have this kind of dashboard and record view. So now we're going to demo some processes, just so you can kind of see how the app works. So we'll start from the beginning of a provider workflow. And really the first step for a provider is to complete a review of a referral that has been sent to them. So let's use Mimi as an example. You can see that Mimi has been received by Sound Health, and you can see that we would like Sound Health to review the referral and respond. So I'm going to click into Mimi, and you can see on the right that there's an action for you to take. This helps you easily accept or decline a referral. What would you do is you'd look at Mimi's information, open up all of the referral information, understand if your organization could take Mimi on as a referral. For the purposes of this meeting, I'm going to accept, and it's going to ask me a couple clarifying questions. So I'm just going to say that the current turnaround time that we have is 1 to 2 weeks, and I can accept it. And because that's pretty simplistic, I'm not going to add in any information, but I'm happy to supply it. Sometimes, of course, we have 7+ weeks or not applicable, and our providers have the option to add more information. But I will just submit this right now. So now what is great is that you can see that the status has changed for Mimi. It says pending ICN confirmation. That means that the hub manager is reviewing your response to see if you are the right provider for Mimi. Because sometimes we know that a provider will have a long turnaround time and will want to probably go and ask another provider if they are a better fit for Mimi. So I'm going to have Erica, my coworker, confirm the referral as a hub manager on her side. We're just speeding up the process. And let me know when you've done that. And I'm happy to kind of wait for that.
Yep, we are good to go.
Oh, you are? Okay, great.
Yes.
So let me go back to the dashboard. Should be match confirmed. Thank you. And now it says the provider name is Sound. Appreciate that. And so that lets you know that the provider can now initiate intake, as it said before, pending ICN confirmation. So again, really having the dashboard be a really good way to manage your referrals. However, in addition to that, we know making a qualified match is really only one part of ensuring a referral is made. It's also important to ensure that the student's actually enrolling in services, and we know that's really difficult to do. So the second part of the main workflow for providers is to provide status updates. For the last 6 months, we've been sending out status updates on a monthly basis to our providers on the call. They're probably very familiar with that. But we received a lot of feedback from our providers and our school counselors as well. So we are updating the cadence for the next school year. And so now we're going to request an update on a weekly basis until a referral becomes active. Once a referral is active, we'll be sending requests to providers on a monthly basis. And we're doing this because providers have had issues getting in contact with students and their families. So by changing the cadence to weekly until a referral is active, we hope to solve or mitigate these outreach issues because school counselors can be notified of these issues and try and close those gaps because they are with the students usually 8 hours a day. So if we go back to our example, let's use Ariel. You can see that it says update requested for status. And you can see when you go in that there's a little action button to provide an update. So I'm going to click that and I'm going to say scheduling, and I'm going to say that we've contacted the student twice, and I say having issues contacting Ariel and their family would appreciate any help. So then I'm going to submit that status, and it's going to go back to the school counselor who can see that information and be like, okay, let me connect with Ariel. Let me see what I can do to make sure that they're going to connect with sound and do intake and really get the services that they need. So those are the two main workflows for providers. Again, we're very happy and we hope you're happy with this improvement for next school year. And happy to kind of answer questions later on during the Q&A. This is something that we'll be working with our providers to launch and introduce and train on as we get closer to the beginning of next school year.
So when we talk about the expansion or the hub software, this is specifically for behavioral health right now. But we are also looking to expand because this is not just a need for the students that we're screening with SBIRT. This is a need, right, in our entire community. And so we are looking to expand to all of the rest of our middle schools. And then also 3 elementary schools and 2 high schools. And so this is where we're wanting your input. We are going to be sending a follow-up email with a survey link where you can provide your input of what schools you think we should expand to. Because you know your caseloads best, you know, all of that stuff. So that is going to be helpful for us to look at, you know, where we expand, and then also, you know, considering as a community mental health provider, what's your productivity look like? You know, what we're noticing is that our students that we don't refer to Hazel Health, it's because they are wanting in-person services. Okay, so that's one of the things that we're really hoping that we can eventually achieve for our students. And so wanted to let you know and give you a heads up that you might be receiving a survey, so you can provide your input with that, and we would really greatly appreciate your input with that. And now I'd like to hand it off to Mary Jane from the City of Renton, who's going to talk more about the new hub services as well as funding availability.
Thank you, Davina. Hello, everyone. Mary Jean Van Cleve. So I am with the City of Renton. I currently oversee the Department of Parks and Recreation, which includes our Human Services Division. And when I met Adam and this team, I was overseeing a department that it was called Equity Housing and Human Services. And so kind of taking that DNA into this department, really excited to be about a part of the project. So our role is to provide funding to secure the infrastructure. And the reason we believe in it is we need to invest upstream. Human services serves all ages, but according to our analytics in terms of who we serve the most with our services tends to be women and children. And we recognize that this was a huge opportunity to invest in an infrastructure that served the community. What we didn't know and what we're looking to grow upon and understand is, are we overlapping? Are we investing in the organizations that are of best interest for the families in need, as well as tailored services to the students who are needing these services? So we're still learning. Our purpose and interest is, again, to invest in the infrastructure. But what we're also looking at is subgranting. This is a huge opportunity to expand upon how we deliver human services, what our configuration and structure is. And we know we've funded some of your organizations as well as we broker. So we're able to give city funds by way of this brokering process. But what we recognize is it's a good system, but we need to figure out how to expand and evolve and add some additional spokes to the wheel that we currently provide services through. And so this has been a bridge and an opportunity to coordinate and align with the school district in terms of understanding student needs. So we're still in the infancy stage. What we're really doing is looking at and looking towards the school district and using the analytics produced from this process and system to inform us. Right now, we're in preparing for our next 2-year budget cycle. That's where we allocate those contracts for the next 2 years, but we are securing funding on the side to ensure that we can be responsive to opportunities that pop up, as well as look at how we continue to provide support to the school district by way of the hub, but also through Vicki and Davina in terms of where they may have staffing resource needs, and figuring out where we can really stretch our comfort level and stretch our dollars to make sure that we're supporting not just by by way of the design of this portal, but also the staffing that need to be behind it in order to make it be successful. I honestly look at Health Commons as my human chat GPT. I recently went to this conference where it was government and AI. It's called our ICMA, which is the International City Managers Association. And we were so bad. We do not speak technology well. I'm like, my own computer was struggling, so I just had to switch to my laptop. But the question was asked in the audience, and it was, it's not only nationwide, but it's also international. Who has a data set scientist on their staff? And one agency put their hand up. So to say that we need help with technology to leverage our systems is an understatement. And so I do really appreciate this opportunity to grow. I'm learning an immense amount, and the fact that we have this opportunity to invest in this and also future expansion of not only behavioral health services, but home services and housing services is going to be the next era. It seems daunting and impossible, but our city tends to have tons of resources. We are always ripe with opportunity, but we just have so much disconnection. And so this is a chance for us to close those gaps. And that's it. That's certainly my perspective, and I'm happy to share more, but always proud of the work of the school district and happy to be a better partner.
Thank you, MJ. Yeah, and what's great about the partnership with the city is with the investment that they'll be making in both the school district and the hub infrastructure. We're now starting to outreach to additional providers. So we started by onboarding youth behavioral health providers, but we're now looking to add housing providers. And I think some of the providers we've outreached may be on the call here today. So it's an exciting step. We know it's incredibly challenging work to be able to figure out, how to do this intelligent matching process between different provider types, and housing and behavioral health are not the same. So we've got a lot of work to do, but the funding is really going to make that work possible. So it's greatly appreciated. I think we're now at where we'd really like to stop talking about, the work. We've sort of shared both, where we are today and where we'd like to go, but we'd love to hear from the audience. In particular, we'd love to hear thoughts about, potential expansion into these new areas like housing providers. I know we have some folks from the state, OSPI, and I think Healthcare Authority on as well. We'd love to hear, your perspective looking through the state level, at this work and some of the work I know that's underway there. So please feel free to kind of jump in and ask questions or provide thoughts and feedback.
I can add something, Adam, before, what people think about what they want to ask. The other benefit of the analytics that I think we're going to discover is not everything is social services. So the value of human services being in parks and recreation can help influence the design of other layers of opportunity within our governmental structure, right? Some of these, it's more activities. Some of it is recreational, and we also can incorporate, and we've had before, social emotional learning. So what we see is, yes, we have the harder strategy of intelligent connection, funding of organizations, but what else can we glean for it that influences other operations and design to, again, continue to go towards that holistic model of support for students? And so that's another avenue and layer that we're looking to expand upon because we do have limited resources. And so from our perspective, we have to be very intentional and strategic and start moving closer in that direction. So I will be looking to assign that to Parks and Recreation from a design standpoint with this information. And we've already had some really neat opportunities of discussion around this topic. So just wanted to put it out there that I think the digitizing of this and the analytics of it really has some larger residual effects.
I have a question.
Go for it, Jennifer.
Okay.
So I'm Jen from Kent Youth and Family Services. I think all of this sounds so wonderful, and it's really been great to sit in this presentation and see how big actually the coordination and referrals, this coordination is. It's really actually quite encouraging. I might have missed a piece of information where the transition to the new hub, like when that might take place out of Teams, and if it's completely going to leave Teams and transition to this other platform.
Yes, great question, Jennifer. That's probably my fault. It's still going to be in Teams.
Okay.
So it'll still be in Teams in the same software. It's just going to look very much more advanced than it currently does. So we're very thankful to our behavioral health partners for the last 6 months for, working with a system that I think was an improvement, but had a long way to go. And so we've taken really all that feedback. And so the application is going to still remain in Teams. It's just going to look quite different. Yeah.
Thank you.
Mm-hmm.
Yeah, it's a great question. And, as Vicky was talking, just, reminds me, maybe one of the silver linings of the pandemic, which, there aren't many, is, both the forcing function that has kind of brought a lot of these partnerships and coordination opportunities together, but also the sort of technological innovation in groups like Microsoft, where they said, they advanced the Teams platform 2 years and 2 months over the pandemic. So a lot of the technologies have moved so much further forward, and really the technology is no longer the barrier we're facing in really doing this care coordination work. A lot of it is organizing the humans, which just by being here today, believe it or not, we are getting organized for this work. And then the other big thing is the financing, figuring out how we can braid financing together to support the labor and the infrastructure that's required to deliver these services to kids and families. What we've learned is there isn't really one checkbook that's going to be able to float the entire network. So we need to figure out how to bring other partners together with the city, with the great investment that's come from OSPI and the Stronger Connections grant that's helped fund this work. And bring other investments to the table that can sustain this infrastructure. Other questions or thoughts or hopes and dreams for this work that are coming up for folks?
I will say, when we first started having these conversations, it was really looking at how are we serving our students and families and how are we providing equitable access, right? So no matter what school you go to, you're going to receive some sort of support that you were receiving at your previous school. And so that is really the intention, is providing equitable access to address the needs of our students. So it's no matter what area of Renton you live, you're going to get that support. And that is really what this is about. And one of the things, like MJ was saying earlier, really pro-social activities, right? Why do we have to wait, right? So looking at how do we be proactive in addressing the mental well-being of our students and families. And instead of, waiting until our kids are struggling or have any deficits when it comes to coping or any of that, that's really what the intent is of this hub, is really how do we look at the whole child and how do we serve the whole child in an equitable way. So that's my dream and hope. So if anyone wants to add that, I would love to hear any thoughts on that, or anything.
I would add again, I'm coming from a government standpoint. When I'm speaking to the council or the mayor, there's a lot of conversation right now, and it's not that nonprofits are not performing very, very hard, but it's not always easily transparent on who's being served and if services are being rendered. So there's a lot of conversation around accountability, and it's on us as government. Like, are we contracting? Are service providers being responsive? And so having this tool to show and demonstrate services are being rendered by students is been a very big narrative tool for me to articulate the need to invest in this system. It is having that ability now. And so that's been a huge selling point, and I hope it helps providers as well in their analytics when it's obtaining funding or grants or things of that nature. But that was a talking point for myself in understanding why we should, as a local government, be involved and entrenched in this way with the school district. Because it's been, it was like, well, you're not the school, that's the school. And we were bridging the gap in understanding where we actually significantly overlap and how we serve the same portion of the community. We're just not doing it in a coordinated way and in a way that we can tangibly prove. And this is doing that.
Well, thanks, MJ, and thanks, Davina. Thanks, Jennifer, for your question. I don't want to keep folks unnecessarily long. I know the summer is all calling us to get outside, and yeah, we really appreciate everyone's participation. And we'll share more about the next Learning Network session when school comes back here in August. So have a great summer. Thanks, everyone.